Hi, I'm Sam. This is my head to toe assessment. This is my patient, and then we have Katie filming. She's gonna pan the room. Okay, perfect. I'm gonna get started. I'm gonna knock. Hi, my name is Sam. I'm gonna be your student nurse today. I'm going to be doing a head to toe assessment. Could you verify with me your name and date of birth?
Emily Loughran, 11/22/98.
Okay, I'm just going to check your wristband. Perfect. And then I'm going to check the electronic health record. I'm going to wash my hands and provide some privacy. I just have some other questions for you. Do you know where you're at?
School.
Okay, and then do you know why you're here?
For a head to toe assessment.
Okay, and then do you know today's date?
May 11, 2026.
Okay, so patient is alert and oriented ×4. Patient is level of consciousness. She's alert and responding appropriately to the situation. Patient is dressed appropriately for the situation as well. And so during the assessment, I'm going to be placing my hands on you. Are you okay with that?
Mm-hmm.
Okay, and then do you have any pain?
A headache.
Okay, and then is there anything that makes your headache better or worse?
Tylenol has helped. Nothing's making it worse.
Okay, and then when did this start?
Yesterday.
Okay, and then on a scale of 0 to 10, 0 being no pain, 10 being the worst pain, how would you describe it?
5.
Okay, and then could you describe the pain and how it feels to you?
It's a sharp pain in my forehead.
Okay, perfect. Thank you. I'll let the provider know. I'm going to do hand hygiene. I'm going to put some gloves on. And while I'm doing that, I'm just going to assess your face. So I'll have you puff out your cheeks for me, and then smile, and then stick out your tongue. Perfect. Okay, so your face is symmetrical. I don't see any signs of drooping, and your head is erect, your posture is erect. It's midline. If I could have you take out your hair for me. So I'm going to be going through your hair, and yes, you do have beautiful thick hair. So I'm just going to be going through, looking for any lesions. Then skin color is appropriate for ethnicity. I'm not seeing any redness or bumps. No extra critters. Your hair is thick and shiny and well distributed. And then I'm just going to come on this other side here. I'm just going to lift your hair up and check below. And then I'll have you turn that way. Wonderful. Now I'm just going to palpate your head. If there's any tenderness, let me know. I'm not feeling any masses or indents. And any pain with that? Nope. Okay, so the head is normocephalic. I'm just going to change my gloves here really quick. I'm going to start with looking at your eyes. Do you wear any corrective lenses?
Nope.
Okay. Perfect. So I'm going to have you start with, I'm going to have you pull down your eyelids for me. Okay, so and you can release them, thank you. The conjunctiva is pink and moist. The sclera is white, and the irides are round. And then I'm going to have you follow my pen. So I'm going to start with just bringing this forward and back. Good. And then I'm going to shine a light in your eyes here. So, and then I'm looking on the other side. Okay, we're going to do the same thing on the other side. I'm checking the other side. Okay, so your pupils are round, equal, reactive, round around equal. Pupils are round, equal, reactive, and accommodating, and reactive to light and accommodation. Whew, okay. And then I'm gonna have you follow my pen here. So we'll go over here, and here, and up here, up here. Okay, so your extraocular movement is smooth and conjugate to the six cardinal directions of gaze. And I'm gonna look in your ears. Look behind your ears first, so your skin is intact. I don't see any lesions or bumps. And then I'm gonna look inside of your ear, and there's no lesions, a little bit of cerumen. And then I'm gonna look behind your ear on this side. And again, no lesions or bumps. And I'm gonna look inside. And then no drainage on either side. Normal cerumen bilaterally. And then I'm just looking at your ears. They are symmetrical. Do you wear any hearing aids? Okay, wonderful. Do you have any hearing impairment?
Nope.
Okay. All right, and then I'm gonna look at your nose. So your nose is straight. I'm gonna have you look up. And I'm looking inside, and no drainage, no lesions, and the septum is midline. And the skin, there's no age marks. I'm gonna have you plug one nostril and breathe in and out. And then same thing on the other side, perfect. Were you having any difficulty breathing through your nose? Okay, so your ears are patent bilaterally. And moving on to your mouth, I'm gonna have you just smile. Okay, so your lips are nice and moist, no cracks. Then go ahead and open. Okay, and then I'm gonna have you say ah. Perfect. I'm gonna have you lift your tongue up, and then to the left and to the right. And you can go ahead and put your tongue back, and I'm just looking at your teeth. Okay, so your mucous membrane is pink. Your gums are pink and moist. Your tongue is midline, your uvula is midline. Do you wear any dentures or any removable?
Nope.
Okay, so you have good dentition. Perfect. And then I'm gonna move on to, I'm gonna assess your lymph nodes. So I'm gonna place my hands on you. While I'm doing so, if there's any discomfort, let me know. So I'm gonna start with the pre-auricular, and then I'm gonna come down to the submandibular, and then the submental, and then I'm gonna do the anterior cervical, and then I'm gonna come back to the posterior auricular, and then the posterior cervical. Was there any tenderness? Nope. Okay, wonderful. So no palpable lymph nodes, no tenderness. Wonderful. And I'm gonna check your carotid pulse here. So good, strong pulse. Okay, so your pulse is equal bilaterally, regular rhythm, I would say at 3. And then no jugular vein distension. And then I'm gonna listen with my stethoscope to your carotid. Okay, so no bruise, and then when I was feeling, I didn't feel any thrills. And moving on, I'm going to have you, you can face towards me, and then you can roll left, and then right, and then up and down. And then without moving your shoulder, try to touch your ear to your shoulder. And then same thing on the other side. Perfect. Was there any pain or discomfort? No. Okay, so patient has full range of motion in the neck. Good. Okay. Moving on, I'm going to assess the thorax. So I'm just going to start with palpating and let me know if there's any tenderness. Sorry, my hands are cold. Might feel good, might not. Any tenderness there?
No.
Okay. And same thing on this side. And while I'm back here, I'm going to just feel your spine for any disformities. Okay. Any tenderness anywhere?
Nope.
Perfect. And your AP is 1 to 2 normal chest size with no labored respirations. No labored respirations, no accessory muscles being used. And then I'm going to listen to your lungs. Okay, so I'm going to start with the right apex. Sorry.
Nope, you're good.
Go ahead and breathe in and out. And then the left apex. Good. And then moving on to the upper right lobe. Go ahead, breathe in and out. And the, in case I missaid it, that was the upper right lobe. This is the upper left lobe. Go ahead and breathe in and out. Good. And then I'm going to go down to the upper left lobe again. Okay. And then I'm going to, sorry, excuse me.
You're good.
And then the right middle lobe. Okay. And then if you could lift up your shirt. Perfect. And then this is the lower left lobe. Good. And then the lower right lobe. Okay. And then I'm going to go to your mid-axillary here. Breathe in and out. Mid-axillary on the right, and this is the mid-axillary on the left. Alrighty. And I'm going to go on to the back here. Okay, so I'm at the left apex. Go in. Good. And the right apex. Perfect. And then the right upper lobe. Left upper lobe. One more time. Okay. And then the right, or sorry, the left lower lobe. Good. right lower lobe. And then just one more time over here, left lower lobe. Good. And then the right lower lobe. Okay, perfect. So no adventitious sounds heard. Clear and crisp respirations bilaterally on anterior and posterior. No adventitious sounds. Okay, good. And then I'm going to listen to your heart. I'm going to start with going to the aortic on the second intercostal space on the right side sternum. That's good. And then at the pulmonic on the the left sternal border at the second intercostal space. Good. And then I'm going to go down to the third intercostal space on the left border at Erb's Point. And then down to the fourth intercostal space, left border for the tricuspid. Good. And then if you could lift your brow, I'm going to go mid-clavicular at the fifth intercostal space. I would listen for, you can put that down, thank you. I would listen for 60 seconds and assessing that your apical pulse was between 60 and 100. And then I would go through a second time with my bell to listen for any murmurs or extra heart tones. And I did hear S1 and S2 sounds heard throughout. Okay. Moving on. I'm gonna have you lay flat for me. I'm just inspecting your abdomen here. So there's no surgeries. Could you pull down your pants just a little bit? Okay. So no scars, I'm just seeing some moles, a belly piercing, and I'm going to listen to your abdomen. When was your last bowel movement?
This morning.
Okay. And I'm going to start with your upper left quadrant. Okay. Upper right, or sorry, no, this was the upper right quadrant. This is the upper left quadrant. Good. Lower left quadrant. Okay. And then the lower right quadrant. Okay. Bowel sounds heard in all 4 quadrants, 5 to 35 per minute. If I did not hear any, I would listen to each quadrant for 5 minutes. And now I'm going to palpate your stomach. If there's any discomfort, please let me know. Any pain or tenderness?
Nope.
Okay. Perfect. Okay, so your stomach is flat, not distended, no palpations. And that's it for the abdomen. So I'll have you sit back up. I'm going to do your upper extremities. So from here, I'm going to I didn't say it before. I'm pretty sure I did, but your spine is straight. And I know I said the APs wanted to. Okay. So I'm just gonna place my hands on your shoulder here, and I'm gonna move your shoulder. Any pain or tenderness, there's no crepitus. And then bend your elbow, no crepitus, and then your wrists. Good. And then I'm just gonna palpate. Perfect. And I'm just looking at your fingers. Your nail beds are pink, your nails are clean, and your nails are flat. Your capillary refill is less than 3 seconds. I would do it on all fingers. And same thing on this side. So I'll have you use your arm for this. Bend your elbow for me. Thank you. And then your wrist. Good. And then I'm just gonna palpate. Any pain or tenderness? Oh, okay. And then just assessing your fingernails, your fingers. I would check capillary refill, and then I'm just gonna check your trigger to see if you're hydrated. So no tenting, you seem well hydrated. And then I'm gonna do your brachial pulse here.
Oh, and really privacy. Okay. I think you got it. Yeah. Hopefully you got it. That was good. That was one. I was worried about the apical. There's not the apical, but the radial. Because you didn't say it, and they didn't go back. Yes. Yeah. You like caught yourself. Because I noticed like this part too. I saw that, but I was like, well, let's do it. That was good. Yeah. I'm gonna submit that, and perfect, we got it.
So your brachial pulse is regular, equal bilaterally. I would say 2. And then I'm gonna check your radial pulse.
It has to be under 30 minutes too, right? It was, yes. Oh, maybe the pen just happened. Hey, wait, is everybody done? Practically? Good lord.
Okay. Your radial pulse is equal and regular bilaterally. Just give it a 3+, and then I would count your radial pulse for 30 seconds. If it was not regular, I would count it for 60 seconds. And then we're gonna do some range of motion with your arms. So I'll have you stand up, and I'll have you just bring your arms up and down, and then bring them all the way back behind your head, and then down past your hips. Perfect. Any pain or discomfort? Okay, patient has full range of motion in her upper extremities. And now I'm going to have you sit back down. I'm going to check for...
Two of us are done. Questions?
I'm gonna have you stand back up, I'm sorry. Okay, so I'm just going to I'm gonna place my hand on your hip, and then I'll have you kind of kick out your foot, so I'm just feeling for any crepitus. Perfect. I'm gonna have you do the same thing on this side. Perfect. Okay, and then go ahead and sit down.
Like, not all the time, but
And then I'm just gonna feel your legs, any pain or tenderness.
I love it.
Okay,
So good.
good. And then I'm just checking her skin, checking for any ulcers or pressure points, masses or lesions or deformities. Everything is looking good so far. And then checking behind the heels. I'm gonna check your dorsalis pedis pulse. So I'm going to oh, your feet are so cold. Okay. Okay, so your pulse is equal and regular bilaterally, 2+. And then I'm gonna do your posterior tibial. No.
Hi, my name is Jennifer. I'm your student nurse. Can I come in? Yes. Thank you. Can I get your name and your date? Zoe Jefferson, August 9th, 2001. Perfect. Can I see your bracelet? Excellent. I will provide privacy, hand hygiene.
All right, so your posterior
You look towards me when I walk.
tibial is equal and regular bilaterally, and I would say that's a 1+. And if I could not feel for either of those, I would have used a Doppler. And then I'm assessing your toenails and your capillary refill on each. Capillary refill is 3, and I would do this to all toes. Toe beds are flat and pink. And then I'm just gonna check for edema. So I'm just gonna push here. So no hitting edema on the left or the right, and no edema on that side. And then while you're sitting down, I'm just gonna have you try to push your foot down like a gas pedal. Good. Actually do on both sides for me. So push down, good. And I'm gonna have you try to pull them up. Okay, great. And then I'm gonna pull on your legs and you're gonna try to resist. Oh yeah, you are strong. Okay, and then I'm gonna push on your, and yes, okay. So strength is 5 out of 5 for leg strength. And I forgot to test your strength on your arms, I believe. So I'm gonna go back to that. I'm gonna have you I'm gonna do range of motion with your feet first and then do your strength on your arms. So go ahead and stand up for me. And then if you need to grab the wall, you can. I'm gonna have you adduct one of your legs, abduct, and then bring it midline, perfect. And then same thing with the other foot. You're gonna bring it out and forward. Okay, perfect. And then I'll have you bring your knee up to your hip and then just kind of swing it out. Same thing with the other one. Any pain or discomfort with that? Okay, you have full range of motion in your legs. And then I'm gonna have you place your arms like this. And then I'm gonna push and you're gonna resist. I'm gonna pull and you're gonna resist. And then I'm gonna cross my fingers and you're gonna squeeze. Okay, so your strength and your upper extremities are 5 out of 5. Okay, well, you can have a seat, and I think that is it for our assessment. I'm going to make sure you have your call light, your bed is low and locked. Do you have any questions before I go?
No.
Okay, well, thank you for letting me do my head to toe assessment. I'm going to wash my hands, open privacy, and I'm gonna go document my findings.